represented here by the Excellency, the Vice President of the Republic of Nigeria. All protocols observed. I'm honored today to deliver this goodwill message on behalf of development partners that provide development assistance on health to the government of Nigeria and the people of Nigeria. And these agencies are African Development Bank, UNAIDS, UNFPA, UNICEF, WHO, and the World Bank. But first, I wish to convey condolences of development partners to the government and people of Nigeria on the recent deaths of students in the Yobe State. We respectfully salute the President and Commander-in-Chief of the Federal Republic of Nigeria and the Vice President of the Federal Republic of Nigeria, the Federal Executive Cabinet, especially the host Honorable Minister of Health, for the leadership being provided towards achieving universal health coverage in Nigeria. Development partners wish to commend the Senate for passing the National Health Bill, which is now awaiting harmonization by the House of Representatives before assent by Mr. President. This has been a long time coming, and development partners add their voice to the need to conclude the process, as this would definitely, I repeat, definitely advance the universal health coverage agenda. On this, we wish to acknowledge the contributions of the state and the local governments, the private sectors, and all other stakeholders, including civil society organizations, and also traditional and faith-based institutions. We congratulate the government of Nigeria for convening the first presidential summit of universal health coverage. We commend the evidence-based process leading up to the summit, with the hosting of the pre-summit technical sessions, which deliberated on context-specific issues related to improving financial and physical access to a harmonized package of care for universal health coverage, with the underlying element of quality of care. Your Excellency, the Vice President, ladies and gentlemen, we would like to encourage government with all its multi-sectoral partners to take due consideration of recommendations emerging from the technical sessions, especially as they relate to financial options, benefit packages, human resources for health, availability of life-saving commodities, medicines and supplies, and many more. We also wish to emphasize that the inclusion of vulnerable populations as key target beneficiaries is of paramount importance, irrespective of gender, age, location, or income levels. This is very critical. Development partners are hopeful that a posted roadmap towards universal health coverage in Nigeria, with clear roles and responsibilities for all stakeholders, will be developed in the coming days and months post this presidential summit. We also wish to emphasize the need for sustained efforts to monitor and and evaluate the implementation using evidence-based processes underpinned by a functional routine data management system through the National Health Management Information Systems. We reaffirm the commitment of development partners in the health sector in support of government actions at the federal, the state, and the local government area levels. I wish to conclude by indicating that only collective actions will ensure that Nigerians have equitable access to quality health care, especially reproductive, maternal, newborn, and child health, malaria, HIV/AIDS, tuberculosis, diarrhea, pneumonia, cholera, and many more. Finally, I wish you all fruitful deliberations as high-level and strategic discussions ensue in this presidential summit. I thank you all.